The general risk for any surgery that's done, the three main general risks, from the smallest procedure to the largest procedure, are bleeding, infection, and wound complications. The risk of bleeding postoperatively is generally small. It's not zero, so you always have to be vigilant after surgery and look for any bleeding. If you have any drains, if you have surgery that has drains in, you should keep an eye on the drains. They should fill up over the course of several hours with like a punch-colored or a tea-colored fluid. If they fill up quickly with what looks like blood, which is thick, and when I say quickly, I mean within minutes, it just fills right up, that's something that you have to let us know about. And if you don't have drains, if there's bloody discharge or there's excessive swelling, if you have breast surgery and one breast gets much larger than the other, these are signs that there may be bleeding going on. The risk of infection is also small. Infections don't usually show up for 5 to 7 days after surgery. You should take the antibiotics that we give you. We generally prescribe antibiotics for 5 days after surgery, or if you have drains in, for at least as long as the drains are in. So if the drains are in for 8 days, you can stop taking them at 8 days once the drains come out. If you don't have drains in, just for the 5 days. Any signs of infection, redness, discharge, fever, always just let us know. There's always someone around. Just call the office number and they'll page us. But as I said, infections don't generally show up for about 5 to 7 days. If you get a fever within the first week or so, it's usually due to something called atelectasis, which means that the lungs aren't expanding. Postoperatively, after the anesthesia, a lot of times your lungs won't expand, your body gets tricked into thinking that there's some sort of infection going on, so it automatically raises the temperature and gives you a low-grade fever. It's usually 100, 101. Basically, the treatment for that is you got to get up, walk around, take deep breaths, and take Tylenol, and it usually goes away. We don't want you sitting around after surgery in general. You should always get up and go to the bathroom. You shouldn't be walking up and down stairs too much, but you should definitely get up and walk around a little bit. Lastly is the risk of wound complications. Depending upon the surgery, wound complications, the risk is also small. Wound complications risks are much higher in smokers and diabetics. You should make sure you should not be smoking 6 weeks before the surgery and 6 weeks after the surgery. But smokers and diabetics are at a higher risk of wound complications. Most wound complications are generally treated conservatively, meaning they just heal up on their own, sometimes with some wound care. More serious complications is a risk of clotting and what's called a pulmonary embolus, which is a clot in the lung. Those are usually in larger operations, abdominoplasty, body lift procedures, and those patients are generally on some sort of blood thinner like Eliquis. If you notice at any point leg swelling, it's usually one leg, but it can be both legs, that's unexplained, or a sudden acute shortness of breath, trouble breathing, and people ask what that means, you'll know what it means. Something just doesn't feel right. And then lastly, the general risk for all surgeries is scarring. The risk of scarring for surgery is 100%. You will have scars. The only thing I can guarantee you about scarring is that you're going to have them. I'm going to close it, you're going to heal it, and then usually around 6 weeks afterwards, we have you on a scar regimen afterwards, try and minimize the appearance of it, and we have modalities, light-based treatments, microneedling, to try and minimize the appearance of it. But I have patients who have scars you can't see, and I have patients who have scars that are more noticeable, and I close everyone the same way. So it's really more a function as to how you heal. So there will be scars, but those are the general risks of any surgery.